So Tommy John surgery is usually framed as a physical setback, right? But, like a torn ligament, a repaired elbow, and a path back to the mound. That's the whole, process. But new data suggests that for many athletes, the mental toll of a UCL injury may linger far longer than the scar itself. In this episode, we're going to explore how elbow injuries affect more than just mechanics and why the psychological aftermath may actually shape recovery as much as even the rehab protocol does. So there was a study published in the Orthopedic Journal of Sports Medicine which examined amateur and collegiate baseball players recovering from UCL injuries. The goal of the study was to assess PTSD symptoms during the recovery process. The results, well, they were pretty eye-opening for most of these guys, and it's upsetting at least, right? 68% of the players showed PTSD symptoms, with 28.8% meeting clinical diagnostic thresholds. 18.3% were classified as severe, and another 21% raised clinical concern. That's horrifying. 92% reported intrusive thoughts, flashback mental replays, or a persistent worrying affect. 94% showed avoidance symptoms like emotional suppression or detachment, and 88 of them expressed hyperarousal, including sleep disruption, irritability, and trouble focusing. So what does this all mean? College athletes, when compared to the high school athletes in the study, actually had higher PTSD scores than their high school counterparts. Pitchers showed more symptom severity than two-way players or just position guys, which, if you break it down, is likely placed on the fact that their identity is centered around only one aspect of the game. UCL injuries, right? They've always been approached through this sort of biomechanical lens. How did this happen? What was the training? And then also from surgery protocols and rehab protocol timelines, right? But this research sort of reframes injury as a psychological event as well, not just a physical one. And the symptoms we typically associate with trauma, intrusion, avoidance, hyperarousal, and are unfortunately showing up routinely in how these pitchers are recovering from elbow injuries. For many, their throwing arm isn't just a limb, it's their career, right? It's their confidence, and in some cases, and when there are two involved, it's their identity. And when that becomes threatened, it creates more than just physical pain. It creates doubt, it creates anxiety, and left undressed, these symptoms can manifest into inconsistent rehab efforts, overprotection, or movement hesitancy, phantom pain, skill loss, and all of that. None of that is tied to their physical readiness, right? And with college athletes showing the highest symptom load, it suggests more pressure at ages higher because of likely the proximity to performance milestones that are needed, like a scholarship or draft years. So you have this increased emotional cost of that injury. If you've ever worked with injured athletes or guys coming back from UCLs, you have to understand that much of that process is going to be psycho-emotional and not just the physical kind. One of the things that we do is we train all of our coaches to look for red flags, like athletes avoiding progression, isolating themselves within the whole community, or expressing sort of these irrational fears around just completing simple drills. Now, by no means are all of our guys clinical psychologists, but we know when and when not to refer out as well, but we have to collaborate with mental health professionals when dealing with these rehab athletes often. We also do a lot of education with our parents, right? The network that an athlete possesses will either wane or increase their emotional strain. And when you have a pitcher who's feeling like their future is basically getting paused, then we're gonna see an athlete who is in a state of loss in terms of their identity. Their network helps shape that identity. So a lot of time is also spent with our parents of these athletes, instructing them and helping guide them on how to communicate, what not to discuss, and ultimately how to constantly bring them back towards the positive nature of where this future can lead. We want to minimize the trauma that we can double down on by forcing timelines. What do we get from this? An elbow injury doesn't just affect the elbow, and real recovery requires more than just strength and range of motion. It requires support, trust, and awareness of the mental cost. This is what we would like to really try and get out there in the world, because we can't run from the fact that injuries are continuously happening. So we have to get better at understanding how to manage the individual before and after these injuries have occurred.